Hello everyone, good morning everybody. Greetings for the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by fungus, yeast, or mold. Mild fungal infections can look like rash, can be itchy, and annoying. So let's connect today with our skin expert, Dr. Vimal John M R, live from Alappuzha to enlighten us on the topic of fungal infection. Dr. Vimal John M R is MBBS, MD, consultant dermatologist. He has many years of experience in this field and he is currently practicing at Epiglow Skin, Hair, and Cosmetology Clinic. And today we have him here with us to talk on the topic of fungal infection. A very warm welcome to you, doctor. Before we begin, let's
Thank you.
talk basic today. What is fungal infection, doctor, in your language?
Fungal infection, just like any other infection, is when your skin gets infected by a fungus. That is, the fungal hyphae break down your skin barrier. We have a protective covering. Our skin is the protective covering of our body. So when the fungus, there are some fungi like basically the fungus which affects our skin. When they come in contact with the skin for a prolonged time, they have enzymes which break down the skin barrier and they get into our skin and start growing there. That's when we call a fungal infection.
Right. So the first thing or the first challenge regarding any disease or any condition is identifying the condition or the disease. So, doctor, how does the initial formation look like? How do we identify that this is fungal infection?
Like any other disease, identification of the cause of the illness is very much important in deciding what is the next stage regarding what kind of treatments you require.
Right.
So, like many other skin conditions, like fungal infection can mimic other conditions such as eczema and sometimes even psoriasis. And many patients go to different doctors and they give a different kind of treatment. And after treatment, this disease it does not look original, like it can look different. So that is when your experience comes into hand. You have to look at the patient's history and then decide what the disease is. And there are now different tests which are handy. Like you can do a scraping, it's called a potassium hydroxide mount, where we take the scraping from the skin and see under microscope and look for the fungus directly. And then there are other tests, like if you are unable to see, like if the patient has received any treatment, then it is difficult to demonstrate the fungal hyphae right away from the scrapings. So in such cases, sometimes we can take like a skin biopsy to see if there is any deeper fungi, or you can even do a culture test in cases such as nails to see if there is fungus. We can take a nail clipping or even the skin scraping also can be sent for fungal culture, where it takes about 2 to 3 weeks for your reports to come.
Right. So now we know that fungal infection can occur at different parts in our body, doctor. Um,
Yes, that's
First of
correct.
all, tell us that what is the cause behind this fungal infection, or does fungal infection in different parts of our body has different cause behind it?
Uh, any disease per se has three components. Like there is something called the basically the agent, that is the fungus itself, and then our body, and then the environment. All these factors play a major role in deciding whether someone gets a disease or not. So fungi, what we have seen in the recent past is like they have become more virulent. So what that
Mm-hmm.
means is they don't respond very much to the ordinary treatment, and they are more capable of infecting people. Like they are spreading much more rapidly than before. And second thing is
Right.
like an individual, we have people with diabetes or other immunocompromised states.
Mm,
So such people
right.
with which who has like basically who are in a deficient immunocompromised state are more prone to
Mm,
get the fungal infection, any infection for that matter. But like fungus is present everywhere. Like you can get infected from other person, and there are other house also, like you can get infected from the pets or from the soil.
right.
So these fungi are present everywhere. So the prevalence of disease, when the diabetes population increases, there is increased risk of fungal infection. The other factor is environment. So in a country
Right.
like India, where we have a hot and humid environment, people are prone for fungal infection because there is moisture. Moisture is a favorable factor for the fungus, and
Right.
the temperature.
Mm-hmm.
Our temperature is also very favorable for the growth of the fungus. So all these things make us very susceptible to the infection. So uh, yeah, these all these factors play like your environment, your body, your immune status. All these factors play a role in the pathogenesis.
Right. So now, speaking of any kind of condition or disease, we know that staying away from the triggers is one of the most important things. Now, talking about fungal infection, doctor, there are a few kind of fungal infections which are very stubborn, like the nail fungus you mentioned earlier. It is a
Yes,
kind of fungus which is stubborn, which takes mm, more time than the rest of the fungal infection in the body to get cured. And we see a lot
that's
of
correct.
people losing hope slowly and gradually that this thing is not going to get cured. So tell us,
That's correct.
doctor, is there a cure for fungal infection and how important it is to stay connected with our skin expert or our doctor whom we are visiting? Mostly we see people, they will continue the medications for a couple of months maybe, and the moment they don't see any results, they'll just give up. So how
That's correct.
important is it to stay connected with our expert and continuation of medication? How important is it?
So, like I said earlier, any infection has three components. Like there's an agent, there's a host, and there is an environment. So the host factor is important. So when you see a doctor for an infection, we usually like you mentioned the nail infection, we usually prescribe for a couple of months. So that is we
Mm-hmm.
expect your immune status like a general population, and usually it will cure the illness, but it is not the same in everyone's case. That's why we call them for a follow-up. So that is very important that you go for the follow-up and see if the infection has been cleared off completely. And you have to get the confirmation from the doctor before you stop the treatment. So people with diabetes or people who work in very humid conditions, have to wear closed shoes all the time, and people who are in contact with the water regularly. So these people
Mm-hmm.
will take much longer period of time to cure the fungus. So in such cases, it is important that they come for
Right.
regular follow-up. And the second factor is, like I mentioned, the virulence. Not all fungi respond to the same treatment before. So we may have to try a couple of different antifungal. There are multiple treatments available. So we always start with the basic steps, basic fungal antifungal agent, and then if the patient doesn't respond, then we go to the other option. So you have to wait sometimes you have to wait for the response to see, and it is important that you do regular follow up with your doctor, and also follow the advice, like keep the area dry and apply the lotions or creams regularly and take the medicines clearly. And if you are diabetic, keep diabetes under control. That is very much important.
Right. Um, now, speaking of the treatment, doctor, a little in elaborate way, what are the treatments that we normally offer when patients come with such kind of symptoms?
Treatment currently we offer topical treatment, that is ointments and creams and then lotions, and then also systemic treatment in the forms of
Mm-hmm.
syrups or tablets. So this only forms the first half of the treatment. That is, the to cure the disease, you should also follow some general things like keeping the area dry. Wearing cotton clothes is important because like a breathable material, and then bathing regularly, at least 2 times in a day. This and you should not share your clothes or soap with anybody else in the household. So all these
Mm-hmm.
things are as important as the treatment. So treatment, like I said, first thing is we give you topical treatment. That is creams and ointments and lotions depending on where the infection is. So if the
Right.
infection is in the general area of the skin, then we can give creams. And if it's a hairy area, then we sometimes give lotions. And
Mm-hmm.
then ointments also can be given. So these creams, depending upon some creams which have to be applied twice in a day, and there are creams which you can apply once in a day. So that has to be followed regularly. And then there are oral treatment. So oral, there are different classes of drugs. There are drugs which has to be taken daily 2 times, and then there are drugs which can be taken like once or twice in a week. So,
Mm-hmm.
depending upon the drug, this frequency of the drug varies, and you have to stick to the drug regime completely. And it's important, like I mentioned earlier, to do regular follow up to see if the infection is cleared, and then only stop the treatment.
Right. So generally, doctor, what do we offer? Antibiotics or antifungals to treat a fungal infection?
These drugs are called antifungal. Basically,
Mm-hmm.
the we basically it's like an antibiotic, but like since it's working against a fungus, it's called antifungal.
Right.
These drugs they break down the fungal cell wall. They have something like the plant have a cell wall. So these
Right.
drugs they break down the cell wall and then they kill the fungus. There are some drugs which kill the fungus. There are some drugs which reduce the growth of the fungus. So in such case, it's the body's immunity which take care of the infection.
Right. So now, when we're talking about medication, we know a lot of people are aware of the medications which our skin experts suggest for fungal infection. So it runs in the
Yeah.
family. We know that the ozole group of medications, these are the kind of medications which we take to treat fungal infection. So whenever we see such sort of symptoms, what we do is we take the medication or we apply the ointment without any concern from the expert or the doctor. We tend to see this is very, very common. We know that fungal infection has a tendency of reoccurring. So maybe the first time the person has visited the doctor and the doctor has suggested some kind of antifungal or, as you said, tropical creams. So the person is now aware that the next time I have a fungal infection or anything such, any such formation on my skin, I now know. Am I audible to you, doctor?
Yeah. No, yeah, you're right. Yes.
Okay. So the person is now aware that the next time I have any sort of such lesion on my skin, I know what to take. So, in such manner, the person is taking his or her own dosage or applying such topical cream. So, how can, or there is another scenario where the person is visiting the chemist and the chemist is offering some kind of steroidal cream. So, how can this scenario affect a patient, doctor?
This is very important in today's scenario where people go directly to chemist and get medications from them. And we have seen that first thing is it becomes difficult for the doctor to recognize the disease because the creams which contain the steroids can alter the how the disease looks. It will look like the disease
Right,
is cleared sometimes, and the patient doesn't continue the treatment or doesn't take any oral medicine, and few weeks later it comes back. And we have seen that even people are taking oral antifungal treatment from the chemist.
mm,
So, if it is not enough for the disease to clear, what happens is these fungi, they become resistant. So they develop
Right.
when the dose is insufficient or they have not following the proper regime. Then in such cases, the fungi, they gain the upper hand. What we call resistance. So in the next time when the same patient goes to a doctor, and if the doctor prescribes the same medicine, it is not going to be effective for them. So they have to switch to a higher level of antifungal treatment, strict,
Mm-hmm.
yeah. So those kinds are like those kind of difficult scenarios can happen, and it takes basically if the patient has applied steroid cream, there is chances of recurrence is very high.
Right. Right.
So it
So,
is important
so
that
doctor,
they go to preferably a skin doctor or a general doctor for that matter, and take complete treatment.
right, right. So I think here two or three things occurs when we are talking about this. The first thing, choosing the right expert or the right doctor for yourself is very, very important. I personally, in my life, I have seen a lot of people suffering just because the doctor or the expert could not identify the condition, or maybe because of wrong medication. As doctor has clearly mentioned, that the formation of the fungi can change if the medication is not offered right. So choosing your right expert is very, very important. Self treating. Please do not self treat yourself. You need an expert to treat your condition. You have to be under the consultancy of your expert. You have to regularly visit. Maintaining your regular hygiene, very, very important. You have to make it a habit. Just like you wake up every day, you brush, you have your food. Just like that, your hygiene has to be a part of your regular regime. So, people who are suffering from fungal infection and who are worried that why am I suffering from this every monsoon or during this season? Why is it occurring again and again? Every year I am suffering from the same deal. This is the reason basically that you are not being treated properly. You are not maintaining your proper hygiene. And doctor initially mentioned about the immunosuppressive condition, people with such condition, you have to take care of that. So maintaining your health is also very important. Now, for all the people who are wondering, um, as we know that moisture is a condition which is very much susceptible for the fungus or the fungi to grow. So now people who are working out every day, doctor, is it possible that in such situation, in a situation like a gym, where people are visiting, where people are releasing sweat, can those sort of condition also be possible that people are getting fungal infection from such sort of situation or environment?
Yes, like you said, in places where people work out, and in other areas like such as outdoor games, when there is
Mm-hmm.
with like a contact sports or anything, so the chances of getting a fungal infection are higher. So you can take some general precautions, such as take like soon after you finish your workout, make sure you take a bath, then apply your moisturizing cream immediately, and this will help to protect your barrier. Skin, like I said, is a barrier. So applying a moisturizing cream soon after having a bath can protect that barrier function. And then other thing is not sharing your whatever clothes you take to the gym. You have to have your own clean towel, and make sure you clean all the equipments before you work out. So with your towel. So that is very important, and make sure you go to a place where they maintain high hygiene standards. That's very important. And if you take care of these general things, and make uh, make sure that you wear a cotton clothes which can absorb uh, the the sweat, and also there are powders which are available which can absorb the
Right.
sweat, so which we can
Mhm.
give to these people who are like regular to the workout in the areas the sweating prone areas of the body. They can apply this, and it will prevent that like sweat getting accumulated there and having a fungal infection there.
Right, right. Doctor, also, initially, before we started this live, I said that we will be talking basics because we normally tend to miss out on the basic things.
That's
We
correct.
try and focus on the major things, on the big things, but we miss out on the basic things. And we know that to live a happy, a easy life, living basic is very important. So, people, we are talking about not washing our clothes together, not using our intimate items, maybe. But because of technology or because of the growing pace, we see that places are very enclosed, buildings are very enclosed. In such scenario, we do not get ample amount of sunlight to dry our clothes. Very important. Uh, Moisture in our clothes. During the monsoon, especially, we see that the clothes are being piled up for a week maybe. By the end of the week, we are washing all the clothes together and there is no place to dry. The washing machine is doing half of the job and the rest may be air drying. So for the people who are not able to dry the clothes in the sunlight during the monsoon period, what can be another alternative for them?
They have to iron the clothes, like because if the moisture content is present in the clothes, then it is like giving a basically a favorable environment for the fungals to grow. So in such cases, it is important that you iron the clothes and make sure it's completely dry, and make sure you wash your clothes separately. So if anyone in your household has an infection, fungal infection, so when in such cases, it is important that you can wash that person's clothes in hot water. So that will kill the fungal elements which is present in the cloth. Also, make sure that you wash your clothes separately from those who have the infection, and then iron all your clothes, including your innerwears. Make sure that there is no moisture content left in the clothes. That will help you prevent from an infection.
Right. Uh, Doctor, also tell us. Uh, we have a question coming up from a viewer who is Deepak asks, can fungal infection make hair fall out? Is it possible?
Uh, yes, it can. Fungal infection can cause hair fall, especially uh, in children. Actually, like it's not so much in the adults, but children, there's something called tinea capitis. That is infection of the hair follicle. That can happen, and in the area which the infected area, they can have a hair fall, like hair breakouts can be there, hair fall can be there. So when a child comes with the hair fall, especially in like in a patchy area, in a particular area of the scalp, this is one condition which we look for to see if there is any fungal growth, if it looks like any fungal infection. Then we can do some tests like wood slam, then looking it under UV light to see if there is any evidence of fungal infection there. So yes, hair fall can happen from fungus, but it's usually in the younger age group.
Right. Another kind of fungal infection people are bothered with very much nowadays is fungal infection in the intimate area, doctor. We know that people who are working in an office setup using the public toilet, the common toilets are very much important for them. They have no other option apart from that. So, what are the kind of preventions or precautions they can take in to stay away from fungal infection? Or is it possible that fungal infection can be spreaded from such common toilets or washrooms?
Yes, that is basically formites, like the areas which are come in contact with people can transmit that disease. It is a known fact, and you can uh, do some things like there are some topical sprays which are available in the internet. You can buy those to disinfect the area before you use the toilet. Uh, So that is one way, and also always wash your hands after using the toilet. Wash your private area after using the toilet properly. So all these things will help you to prevent the infection.
Right. So doctor has clearly mentioned that washing and keeping it dry is also important. For women, we know it becomes a challenge for us for keeping the area dry all the time. So, what I would suggest every time you go to the washroom, ladies especially, rather than investing on medications, we would suggest invest on tissue papers. Please use
Yeah.
tissue papers and keep your area dry. Very, very much important. We know how suffering it is. We know how painful it gets. So please make the wide use of tissue papers. These are clearly available in the market. Clean it and use your tissue papers rather than using all those artificial products which are available in the market to keep your area smell flowery, which is not required. Just plain water is, I think, sufficient. What do you say about that, doctor? We get a lot of products in the market, those intimate washes which are available. We see women who are widely using it also complaining about it. Also, there is an entire set of women who feels or who believes that using such washes are very much important. Keeping the area um, uh, thoroughly clean is very much important. What do you suggest?
Uh, so basically, the what is available from the market, what the product is trying to do is, uh, when you see the female genitalia, they have a different pH compared to the males. So when you
Hmm.
use something like a soap, the pH of the area changes. So normally in your skin there are bacteria which are present. Normal bacteria is present. So that gives us some immunity to other infections. So what happens when you use the soap or any other material is it changes the pH. So these bacteria which are normally present cannot thrive in such pH, different pH. So there is a change in that microbiome. So that can predispose people to infection. That is a known fact. And these products they try to do is they try to maintain the pH. It does help sometimes, but it's not 100% fail safe. Like you mentioned, like it's always important that you take care of other things like maintain proper hygiene. Uh, like
Hmm.
if you're using tissue paper, that's fine, but use it properly and regularly. That is important.
Right, right. So
Okay.
whenever people who are worried regarding the usage of anything, I think visiting your expert is very much important. He or she will be able to suggest you the right and the correct way to use it, because there is also a right and correct way of using things which are lying around you. You just do not use it. You know, you need to know the right way of for using it. Now we'll quickly dive into the question which comes from our new and the next viewer, Doctor Ahmed Khan asks,
Okay.
can tight clothes cause fungal infection?
Yes, tight clothes which prevent breathing of the skin can increase the moisture accumulation, and it can basically cause more sweating. And whenever there is more moisture content available, that is a favorable environment for the fungus to grow. It can cause fungal infection, especially things like jeans and uh, clothes which we do not wash regularly. There are clothes like if it is like a very like thin clothing which with proper ventilation, then it's okay. But if it is like something like a jeans, then uh, it's better you avoid during the hot and humid conditions.
Right, right. Um, Doctor, also tell us, can oral antifungals be safe to be taken during pregnancy?
During pregnancy, we try to avoid oral medicines as much as possible. There are safe
Mm,
medicines which are available in cases if there is extensive fungal illness, fungus has spread to more areas of the body. There are safer agents which are available now, which you can take after consulting a dermatologist. But as much as possible, we try to avoid any oral medicines possible during pregnancy. We try to manage it with topical creams. But it is important that you know that there are options available, safer medicines are available, but only for
Right.
such difficult cases we use it.
Right. Again, coming to the same point here, that do not self-treat. Please, people
Yeah.
who are just taking medication, knowing that this is a medication that can treat your condition, does not work like that. Please, please, only under an expert supervision, you are supposed to take such medication. Moving back to the next question, which comes from John, asks, walking barefoot increase can walking barefoot increase the risk of fungal infection?
Yes, especially if you're in a humid environment, like in like say near a swimming pool. If a person has a fungal infection and they are not wearing a footwear, they can have the fungus. Basically, the fungus can stick to the foam at the floor there, and another person who's also walking without a footwear can get such an infection. So it is a known fact, and it is important that especially people who have an infection, even when they are indoors in their house, in their home, wear a footwear. We recommend them to wear a footwear inside so that other people don't catch the infection. So it's important. Like
Right.
if you're going to a place which is unknown to you, it's better you wear a footwear and be protected than be sorry later.
Right. So today we are talking about fungal infection, but I think another thing which can make any condition worse is your negligence. People who are seeing such formation on your skin. Speaking about fungal infection, you see that your skin is changing or there is a certain kind of lesion on your skin and you neglect it. You'll be like, it's okay, fine. Maybe I'll apply the typical antifungal or the typical antibiotic or the antibacterial which we have in our home. Borolene, Boroplus, these are the things which are very easily available, and then it'll be fine. Or we will just use some home remedy. In our Indian society, we see people, they believe such home remedies widely. So any home remedies we'll just take in and it'll be fine. So negligence can be one of the I think important things which we are missing out today in today's life. That people who are negligent regarding themselves uh, suffers most mainly. So monitoring yourself, monitoring your health, having a routine checkup every 6 months, irrespective of whatever condition it is. Very, very important under an expert supervision again. So people who are missing out on that, please do not forget, love yourself, love your body, and I'm sure you will always, always stay away from such kind of diseases or condition. Moving ahead towards the next question, Amit asks, doctor, can babies also have fungal infection?
Yes, definitely. Babies can also have a fungal infection. Like during birth itself, sometimes baby can catch the infection from a mother. If the mother has an infection in their genital area when the child is born, they can catch the infection.
Mm-hmm.
So we always get called for like if a pregnant lady is having an infection, then we always make sure that we treat them before the delivery process, or sometimes they even opt for the cesarean section, but it's not that much of a problem. But still, sometimes some consultants do that. So yes, babies can catch fungal infection. Yeah,
But can it be genetically transmitted as well? Is it possible, doctor, the infection?
you mean through the blood of the mother? No, it does not get
By genes. By genes, is
by
it possible?
by gene. No, basically it's a fungal infection. People can be susceptible to fungal infection, like say some fungal
Mm,
now some studies say that the fungal infections of the nail, only some people get the infection. Not everybody gets it in the household. So they say there is some genetic predisposition. That is, some individuals are prone for it. So that genetic predisposition can be transferred from mother to child. But the infection is
Hmm.
direct inoculation, like only like externally. Basically, the fungus, the dermatophytes we call it, they have a predisposition. They reside only in the skin tissue. They don't go into the deeper tissues. So there is no blood
Right.
transmission of the illness.
Right. Speaking of
Okay.
deeper tissue, the next question comes from Depi Desai, who asks, is it possible to get fungal infection in the lung?
Yes, there are fungus. So I was talking about the dermatophytes. That is the fungus which affects the skin, the
Hmm.
which causes something called this in general terms like a ringworm. So there are other fungus which like invasive candidiasis in persons who have HIV or other immunocompromised status. They can have this
Hmm.
candidiasis, which goes into the bloodstream. Then there are which can be life threatening. Then other fungus like aspergillosis. Aspergillosis affects the lungs. Basically, it's like can cause pneumonia. And then cryptococcus is another fungus. Again, all these infections can be like it is more commonly seen in patients who are immunocompromised than regular persons.
Right.
So
So,
fungal
so how
infections
does
of
it work,
the
doc? Yes.
uh,
Yes. Yes, doctor.
so fungal infections of the lungs are known, but it's a different fungus which infect the lungs, and the fungi which infect the skin is completely different from it.
Right. So, so how does the fungus affect actually
Uh, you mean this? You are talking about the skin or the other areas?
the lungs? The lungs. How does it work, doctor?
It is spread through basically the air. It goes into the lungs, then it causes pneumonia there. So, which is a life. Basically, it reduces the oxygen available to your body, and it is a life-threatening situation, and that requires
Right.
proper care by the basically by the respiratory
Right.
department. And
Right.
yeah, it will require injectable, and basically it's not the oral antifungals which we give there. We give injectable antifungal treatment there.
Right. Right. So who can think just a fungi or just a fungal infection can be life-threatening? Nobody can think, right? So negligence in such scenario can be really worse. People, please don't be negligent regarding your health. Whenever you see any kind of changes, make sure you're visiting your nearest expert. I'm repeating this again and again because it's very important and we tend to miss out on such things. The next question comes from Tanishka, who asks, does wearing damp clothes increase the risk of fungal infection? I think we have talked about it, but then would you like to throw a light on it, doctor?
Yes, dampness is one important cause because fungi need moisture, and also other thing is soap, which we use. If you don't wash it off properly, again, soap, like I said, it can increase the pH. So this increased pH or alkaline pH is very favorable to the fungi. So it's always important that you take bath regularly, but it's also important that you dry your skin properly after having a bath, or if you have had exposure to moisture with a clean cotton cloth, that will prevent the fungus from coming in contact with your skin.
Right. Also, for all the women, for all the men who are suffering from fungal infection in the genital area or the private areas, make sure you are not using your inner garments year after year. Please change them. Very, very important. Also, we know a lot of people, we miss out on such things, but these things can be harmful even though you're washing it, even though you're washing and using it. But repetitive use of such clothes can also be harmful, so make sure you're regularly changing them or keeping them clean. Now, the next question comes from Kriti Kapoor. Very interesting question. Asks, can I get fungal infection from plant?
Uh, I would not. I mean, you don't get the fungal infection. You can have infections from the soil, like dirty areas. So the same fungus
Hmm.
can be present on the plants, but it's you don't get fungus like the plant. When you see a decaying plant, they have some mushrooms. Those are again
Hmm.
fungi, but we don't get infection from that. The
Right.
fungi which cause skin infection in humans are different, but there are some fungi which are
Hmm.
present in the soil which can
Right.
cause infection. Yeah.
Right. So people who are fond of gardening and who normally doesn't use gloves, please make sure you are using the gloves properly. They are supposed to be used for certain reasons.
Ah,
It can always keep your nails away from such fungus. Make sure you are using the gloves. Also, women who are always in contact with water, housemakers, make sure you're
yes.
using the gloves while washing the dishes as well. It can be a big time relief for all of you. Very easily available in the market. Just a small prevention, just a small precaution can, trust me, it can make you stay away from such pain and such botherance and such anxiety and so much stress. So please use gloves widely. And I believe this is the last question which comes from our viewer, Ria Sathi, who asks, can I get fungal infection from an hospital?
Yes, hospitals, yes, possible, because hospitals are the area where people come to treat such infections. So, it higher chances of you contacting an illness from people, especially if you're going to a dermatology department. So, always make sure after returning from any hospital visit, give a proper bath. There's one more point which I wanted to add regarding you mentioned gardening previously.
Yes.
So people who do like gardening activities, there is one different kind of fungal infection. It's called deep fungal infection. Like I
Hmm.
said earlier that I was talking about the fungus which infect the skin surface alone. But there are other
Right.
fungi which can infect the deeper skin areas, especially if people who are working in the gardening
Hmm.
industry. So there, if they get a skin prick from thorns or anything, any from, and if the mud gets into the gets inoculated there, there is a chance that they can have something like a deep fungal infection that is different
Right.
from the one we have discussed here. And the treatment also is require topical treatment don't work. You have to go for the systemic treatment, that is tablets. And yeah, so that is there is a different kind
Right.
of infection there. Yeah.
Right. So by the end of today's session, we now know that prevention is always better than cure. So make sure you are using all those preventive tricks and tips which we have suggested in our lives by our doctor. And stay away from triggers. People who are already suffering from a condition, make sure you're treating that along with the fungal infection, and maintaining your proper hygiene, very much important. We had a wonderful discussion on this topic, doctor. We got to learn a lot from you. Before we take a leave, any take home message for our viewers who has watched us so far?
Thank you for this opportunity. And one request, like I mentioned earlier, is take care of your skin. Keep it dry. Wear
Mm.
cotton clothes all the time, and change your clothing regularly. And have a healthy skin. Thank you.
Well, that was the expert advice for today, and that was Dr. Vimal John M R for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for our viewers, and we look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and stay healthy.